All right, so we'll kick things off. As I said, good morning and good afternoon, everyone. We're very grateful that you've joined us for this time. For our second workshop of the year, Ethnically Diverse Representation, a measure to equitable healthcare outcomes. We would like to take a moment to acknowledge that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous people, including the Cree, Blackfoot, Métis, and Nakota Sioux. Tomorrow, September 30th, marks the National Day for Truth and Reconciliation, as well as Orange Shirt Day. This day honors children who never returned home, survivors of residential schools, and those experiencing the intergenerational impacts of this dark colonial history. We invite everyone to wear an orange shirt tomorrow and to spend some time learning and relearning about the impacts of colonialism on Indigenous peoples. And now I would like to introduce our incredible speaker, Chidiebere Ibe. He's a medical student, a Nigerian Medical Illustrator. He's the creative director at the Association of Future African Neurosurgeons, Young Continental Association of African Neurosurgical Societies, and creative director and chief medical illustrator of the Journal of Global Neurosurgery. He's also a junior committee member, World Federation of Neurosurgical Societies, Global Neurosurgery and Medical Illustrator at the International Center for Genetic Diseases, Harvard Medical School. Chidiebere is passionate about contemporary illustrations of Black patients and has been acclaimed globally for creating the Black fetus illustration that went viral. He hopes to pursue a career in pediatric neurosurgery. So I'll hand it over to you. Thank you so much.
Yeah, hi everyone. Hi, Hida. Wonderful applause there. I see that. Thank you. Thank you. All right. Good morning, good afternoon. I would say good evening to everyone on this call today. It's about 2 p.m. my time here in Nigeria, and it's a pleasure having everybody on this call. I mean, I assume it should be early in the morning over there, and apologies for bringing you out this early. So it's a pleasure, and today's going to be amazing. We're just going to talk about how my journey in medical illustration and how it has impacted the world and its importance generally. So I was saying that I started illustrations in 2020 during the lockdown, and before then I was actually a graphic designer and an artist. Then I realized from my research that when I started illustrations, that most images on the internet were just white images. Before then, I wasn't a medical student, so I didn't actually understand that there was lack of representation in our medical literature. Then from research on and on, I understood the concept of diversity, the concept of inclusion, and the idea behind equity in medicine, and the lack of representation that we see today in our medical literature. Then I started creating artworks that represent the Black community. And then for me, I understood that the idea behind this is that these images can improve our healthcare outcome, but how can they improve our healthcare outcome? And then I started understanding that there are areas in medicine that were not very representative, and I started working towards creating images like that. Well, to actually start, I would say typically the idea behind diversity or inclusion hasn't really been talked about much. You know, recently a lot of persons have advocated, had been talking about diversity, about inclusion, about respect, about equity, but people do not really understand the concept behind diversity. Now, when you talk about diversity, the popular definition about it is that Black people are the diverse community. And because of that information, there is a place of inferiority toward the Black community. And it's also important to understand that when we say diversity, that no particular ethnic group is a diverse community. Because when we say diverse, it simply means that the other group is inferior to the counterpart. So just to buttress upon that. And these images have been, have created a lot of impact generally, I would say. But statistically, research was carried out at the University of Pennsylvania that just 4.5% of images in our medical literature show Black people. I mean, less than 5% show Black people. And the images that we see in our medical literature sometimes are images of infectious diseases like HIV or like marasmus, which represent Africa differently. And a lot of work has been put in to advocate or to see how we can address healthcare disparity through creating images that portray Africa in a positive light. So as a result of this, people have worked assiduously in creating images like this. Now, when we say Black people are represented in medical literature, how much do we talk about this much? How often do we hear people talk about images like this? Because last year, when I created the Black fetus that went viral last year, a lot of people in the healthcare community said that they have never seen an image of a Black fetus in their entire life. I mean, for 50 years in the healthcare space, they have never seen image of Black fetus ever or any Black illustration ever. But little effort has been done towards this. But how come the healthcare space hasn't really seen more about this? It simply means that the effort put towards this were not sufficient enough. And for me, when we talk about representation in medicine, it simply means that we have to debunk the idea that white supremacy, right? Because this perpetuates, right, the belief that the white male body, right, is of standard in comparison to other body parts, and which has leads to healthcare inequality in medical education, and of course have further perpetuated, right, the harmful stereotype of Black individuals. So that's why we say when we see images that do not represent the Black community, when we see images that, there has been a cliche or information that the white images are the standard to which other images should be compared to. And because of this information, because of this idea, it has affected, it has created a harmful stereotype to how Black people have been perceived. And this, of course, have affected how Black images or how Black visuals are being created. I mean, from inception or from the background of medical illustrations, the father of contemporary illustration is Frank Nater, which of course most of us should be familiar, who created most of the medical texts that we see today. Most images that Frank Nater created were all white images. And of course, that's the foundation to why most images that we see today in our medical literature are just white people, because the concept or the foundation to illustrations were all white illustration. And this of course plays a role to talking about racism in medicine, talking about disparities in medicine, because not considering a diverse community through visual representation is an approach towards racism, is an approach towards lack of representation. And of course, this has affected health outcome for the Black community. I mean, to talking about more of this, let's to talk about in terms of maternal healthcare. A popular story of Serena Williams, which of course, she's a celebrity and popularly known. She was pregnant, and of course, she went to her physician, and she was in the hospital to deliver her baby. Then at the point of delivery, she had a cesarean section, and after the cesarean section, she said to her nurse that she feels that she has a tendency of having. I mean, she felt that she had a numb teeth, and she said that she should that she has a pulmonary embolism, and she should receive a heparin drip. And the nurse said that she just reacting to drugs that she took, and because of that, the nurse wasn't listening to her, and then she called up for her doctor, which thanks goodness listened to her personal plight and her condition. And of course, due to some CT scan, they realized that she, of course, had pulmonary embolism. And that is one of many cases where a Black patient wasn't given healthcare attention simply because she was Black. And for me, the idea behind this is that when we create visuals that are very representative of the community, we are directly or indirectly advocating for the minority group. And for me, the idea behind representation is not about creating visuals alone, not about creating medical illustrations alone, but using measures to advocate for the underserved community. Because when we talk about Black people not receiving healthcare, it statistically shows that Black women are 3 to 4 times more likely to die from pregnancy-related issues than white people. And this, of course, it's premised on how Black women see themselves. Because when you walk into a physician hospital, walk into a physician office rather, we walk into the hospitals, and all images displayed in the offices are simply white pregnant women carrying a white fetus. And that's why most women do not feel comfortable, right, going to the gynecologist or going to the physician hospital to talk about the personal issues to the doctor. And this, of course, have affected healthcare outcomes, because one of the most important things about healthcare services is communication. If a patient is not able to feel confident to communicate their personal issues to a physician, that, of course, has a big role in playing in how the healthcare outcome would be seen. Because the idea behind illustrations, or the idea behind creating direct illustrations, is that when patients see themselves, they feel more confident in talking about their personal issues to the physician. As a result of this, the issues of not creating direct images has created inappropriate diagnosis and have created lack of healthcare management among Black individuals. So that's why creating direct images has a role in playing in improving our healthcare outcome. Recently, I was conversing with some medical students in Portugal, where I went for a conference. And we talked about ethnicity in medicine. We talked about how Black images are not being seen. It was sad to see that most of the medical students, they were not aware that there is a term like systemic racism. They were not aware of how lack of representation had affected health outcomes. They were not aware because they were not used to seeing Black people in their community or in the medical literature. And then it was dawned on me that there is so much work to be done. There's so much work that we can advocate, that we ought to advocate for the minority group. And then I said to them that if we look at Africa, for example, look at the minority group, for example, and we look at how the social determinant of health have affected the healthcare outcome, where education, for example, where access to quality healthcare, for example, affect the healthcare outcome. It is also important to know that visuals like these also affect the healthcare outcome. Recently, I took a course online, and this course was talking about community health workers, how they go to local communities in Africa to advocate for healthcare equity, to advocate for safety in malaria or COVID-19, for example. And this, while taking this course, I realized that the resources that the community health workers use in advocacy, using advocacy in this community were all white illustrations. And from what I saw from the videos, most people in the community were not people who understood English, were just local community women who barely understood English. Yet the resources used for advocacy were images that do not represent them. There is so much of a gap in communication. And that's why creating visuals that represent these Black communities are important, and not just the skin color, but the culture, but the ethnicity. Because when we create images like these, it has a big role in telling the Black community or in telling the underserved community that they are important, right? That the healthcare services, of course, should be provided to them irrespective of their educational background, irrespective of their environment. For me, I talk about that. I mean, recently, healthcare has been perceived to be a privilege. But for me, I think in an ideal system, in an ideal world, healthcare is a right and not a privilege, because irrespective of our skin color, of our environment, of our educational background, of our financial status, everybody deserves the right to have equal healthcare, irrespective of our background. And that's why people assume that healthcare is a privilege. And I mean, and because of that idea, the underserved communities are not given equal healthcare attention. Everybody should have experience to having equal healthcare attention. And recently, I actually worked on a project on dermatology where we're creating direct illustrations on showing skin conditions on Black people. And for me, I mean, we partner with a couple of institutions like Harvard, like Johnson and Johnson's and other big companies to creating these visuals. And then I understood that there's been a lot of cases where the physician or the dermatologist didn't have the prior experience diagnosing some skin conditions on Black patients. I mean, talking about the popular Lyme disease, which has one of the symptoms of both eyes rash, where, of course, from visual perspective, from visual inspection, that both eyes rash represent differently on different skin tone. I mean, typically, the symptom or the presentation of both eyes rash on a Black person is not visible. You would not see the signs and symptoms in most cases of Lyme disease symptoms on a Black person. Yet on the white skin, it looks reddish and so conspicuous. But it's amazing to know that most images doesn't represent the same way. This image does not represent the same way on Black skin. And of course, it's shown on dark skin. And of course, in our medical literature, we do not see images of Black people showing a patient with Lyme disease. And this has been a factor to why most physicians do not have the experience to diagnosing skin conditions on Black people. And because of this lack of experience, most Black people have been misdiagnosed, or they have personally misdiagnosed themselves, because when you go to a physician hospital, you go to a physician office rather, you go to a dermatologist and you have a skin condition. I mean, typically, I had a mother who shared a personal experience with me. She said she had skin ulcer, and she's Black, of course. She went to a dermatologist and the dermatologist said Black people don't have skin ulcer. I mean, she came out feeling denigrated. She came out feeling sad. I mean, do Black people truly don't have skin ulcer? I mean, this is just one of many stories of how Black patients with certain skin conditions were disregarded because the physician had no prior experience to diagnosing this skin condition. And that's why it is important that we have to create visuals that represent the Black community. Because if we are seeking towards improving our healthcare outcomes, seeking towards improving how we perceive Black people or the underserved community, it is important to create images, illustrations that are educative, that educational rather, that shows, that helps medical students, of course, to be able to diagnose the skin condition. And it's also sad to say that in Nigeria, for example, most medical students do not know how to diagnose simple skin condition like heat rash, because in their medical textbook, most images to see are white images, and of course, they represent reddish on a white skin. I mean, a survey was carried some time ago by BBC when an interview was carried out at the University of Lagos. Most medical students were asked to bring out a medical textbook to see how well most images represented them. I mean, it was sad to say that they were not able to diagnose simple skin conditions on their own skin. It is sad to say, but that's the reality that we see ourselves. And that's why creating visuals like these to educate Black people, because for me, medical students are actually the future of medicine, right? Because it's difficult to change an existing information that, I mean, our physicians already perceive. But when we educate our medical students about issues of lack of representation, with this, they're able to understand that there's lack of representation. We provide them adequate resources that they see themselves more, where we are not able to break the communication gap that they see in their point of education. And for me, recently, a research was carried out at the University of California, Los Angeles, and it shows that, that United States actually is a state where it's actually the most dangerous country, the most developed country that is dangerous in terms of how they perceive Black women. And for me, talking about maternal health care is actually very important to me, because I understand that for me, I'm passionate about maternal health care, I'm passionate about children, I'm passionate about the healthcare outcome of women and healthcare. Because, I mean, people talk about children a lot, talk about women a lot, but little talk about men, and this have affected how Black women generally are being perceived. So for me, the strategy is that when we create a visual representation that show Black people, that show the underserved community, we are advocating for the minority group. And while creating these images, while creating these illustrations, I started making a lot of research also. And then I realized that sickle cell disease, for example, which was first discovered in West Africa, which affects over 300,000 Africans every year, babies every year, is not very representative. I mean, if you would Google sickle cell on the internet right now, you would not see an image showing a Black person with sickle cell. Yet it affects more Africans than white people. And that's lack of representation, and that affected our healthcare outcome. Because Black people are perceived to, I mean, if you're Black and sickle cell, you are perceived to be a drug addict. And that is the wrong approach towards the Black community. And that's because we do not create image that show Africa in a positive light. And that's why creating visual representation, creating medical solutions that show the diverse community is important, because it also improves a patient's worth. It also improves a patient's value. A patient sees he or herself as important, he or herself as valuable. And of course, is able to have that confidence in talking about personal issues with a physician. I mean, this is one of many cases where, of course, talking about cancer, for example, there's been a lot of cancer disparities recently. For example, statistically, cancer affects more white people than Black people, yet Black people die of cancer more than white people. I mean, take a pause, think about it, reflect on it. It actually shows an issue of cancer disparity, because cancer disparity can also be seen when outcomes, right, are improving overall, but improvement are not seen to a particular set of people or to a particular ethnic group or to a particular race, right? Because recently a lot of technologies have been coming up for cancer. Chemotherapy has been improving, a lot of cancer screening has been improving, yet it still doesn't show in the minority group. And that's why it is important that we create visuals that are educative, with visuals that are educational, visuals that that help show Africa differently. And for me, the strategy is that we have to be very intentional about representation, because if we are looking towards improving healthcare outcome by 2030, according to the WHO standards, we ought to see how we can create visuals that do not just educate people, but represent people. Because a lot has been done about illustration, because people have created anatomical illustrations that educate, which is amazing, which is good. But those images, from my perspective, do not solve global problems. Because anatomy, of course, it's just anatomy, people say, right? But we do not, but looking at it from the perspective of solving global problem, it doesn't particularly solve global problems. And that's why when we consider creating images that would solve the global problem, it is important to look at areas of areas in medicine like dermatology, which is important, like cancer treatment, like Black and women healthcare, childhood healthcare, and which is very important in medicine, which is important in healthcare. A lot of persons have asked me questions like, okay, people have talked about this a lot. How can we address this? How can we address the injustice we see in medicine, the lack of representation that we see in medicine today? Well, the truth is that systemic racism is actually difficult to address, because lack of representation is a factor of systemic racism, and it's difficult to address. And that's why it's important that people ought to confront it head on. We need to talk about it. Imagine having a system or let's say a faculty or a school system where educating medical students about lack of representation or about systemic racism is integrated into their curricula. That is a strategy where people are now being taught about lack of representation. Because for me, I believe that people don't talk about this a lot, and that's why people did not comprehend that it was a problem. Right. So we need to see how we can integrate this in our curricula, where medical students are being taught about racism, medical students are being taught about lack of representation, because medical students have a role in playing in advocating for this. They ought to have a strategy in how we can address healthcare inequality and healthcare inequity in our system. And for me, we ought to see how we can improve our healthcare workforce. Because a research was carried out, and the research shows that when a physician looks more like the healthcare receiver, that there is a tendency to improve healthcare outcome. Because recently, most physicians who treat the Black community do not look more like them. And this, of course, have affected how the Black community feel confident, or how the Black community feel comfortable approaching a doctor that doesn't look like them. So it's important that we can see how we can create representation in our healthcare workforce, more of Black doctors treating more of Black patients, more of white doctors treating more of Asian doctors treating more of Asian patients. Because I think with these, we are able to bridge that communication gap, we are able to bridge that lack of representation. And statistically, we would see our healthcare outcome improve. And also one of the strategies I think is that we need to collect people's story. Because when the image of the Black fetus I created last year went viral, a lot of mothers were telling me personal experiences of how they went through bias through from their physician, simply because they were Black, or simply because they were actually expectant mothers. I mean, so people haven't had the courage to talk about their personal experiences, and that have affected how much people perceive lack of representation. So if we are looking towards improving our healthcare outcome, we need to be able to listen to people's story, to patients' story, because a lot has been going on, but people do not listen to patients. People do not pay attention to patients' complaints, because patients' complaints are not important to the doctor's opinion. And that's why the healthcare outcome for the underserved community is not really improving. For me, that is an approach, in as much as we are considering creating illustrations that show Black people, we ought to speak out. We need to talk about systemic racism. We need to talk about lack of representation, because with this strategy, we can improve our healthcare outcome. With this strategy, we can have a good healthcare service delivered to the underserved community. I mean, just to wrap it up, there was a story there was a research that was carried out some years ago. It's actually a popular test. It's called the Black Doll test. So this test was actually carried out to see how Black people perceive themselves. So children were actually presented with two dolls, the white doll and the black doll, and the children were asked which of these dolls is the one with anger issues, the one with negative issues, right? The Black children pointed to the black doll. And they were not asked which of these dolls had the positive characteristics, and the Black children pointed to the white doll. And then the children were asked which of these dolls looked more like you. And it was sad to say the children actually felt sad to realize that the doll that they pointed to, that they attributed negative characteristics to, was the doll that looked more like them. And the research was actually was made to see how Black people perceive themselves. And it's important to see that if we are looking towards improving our healthcare outcome, it's important that Black people have to see the value in their skin color, have to see the value in being a Black person. And with that, we can see how we can improve our healthcare outcome. And this is more of a call to the Black community also, that because recently a lot of Black people have not been involved in clinical trials, for example. The issue of pulse oximeter not actually measuring the accurate oxygen concentration on the Black skin. As a result of Black persons or Black patients not being involved in clinical trials when the pulse oximeter was being invented. So this is one of the cases where we talk about lack of representation and how it affects healthcare outcomes. So it's important that Black people are involved in clinical trials, Black people are involved in research, Black people are involved in educational educational system, because I strongly believe when we're actively involved in this, it is important that we would see a visible healthcare outcome and in our ethnicity. So for me, the strategy is this: we as a community of people ought to create visuals that are very representative, and because of these visuals, it is possible that it can improve our healthcare outcome. There's more to be done, because the issue, as I earlier said, the issue of lack of representation is an expensive project. It's an expensive, it is difficult to do, but it can be done with a community of people synergizing to talk about this, couple of people who are working together on projects to advocating for this. It is possible. And for me, I believe in by next year, we'll see statistically an increasing number of Black images, because I see other artists right now who are actively changing their illustrations to Black illustrations. Other artists are now focused on creating Black images, on dermatology, on other areas of medicine. And for me, that's the idea, that's the strategy. We need to create a workforce of people who are constantly and who are passionate of representation. Thereby, I strongly believe that we can, as a community of change leaders, improve our healthcare outcome. Thank you.
Thank you so much. We'll open up the floor for any questions or comments and go from there.
I would love to speak. Round of applause for that. Are you able to share the images you created, the pictures?
Yes, I am able to share them. All right, shortly for now, the image will coming up. I'm just trying to load them. So these are a couple of illustrations that I've created, which of course is for breast cancer, dripping, and this is for breast cancer. Let's do fistula, which is a recent project I've created. Yeah, because for me, this particular vitiligo, this is actually an illustration that I love so much, because there's a lot of stigmatization around being a patient with vitiligo, because if you're a Black patient with vitiligo, you are, there's a lot of bias towards that, because there's an assumption that if you have vitiligo and you're Black, you have leprosy, and that vitiligo is contagious. Due to this, this information, it's important to portray the beauty of vitiligo, and that we are all the same, irrespective of our skin condition. So for me, this is the idea. But the idea behind illustration is not just creating visuals, right? But creating these illustrations in a positive perspective, where a patient feels confident to have, feels confident, feel excited about this illustration. So this is one of them I've created about on weathering, where exposure to chronic stress, actually. Yeah, so this is one of the work I've created about twin transfusion syndrome, which actually, for me, the idea behind representation is not just about creating Black people, but considering those who are biracial also. So this is one of the artworks I've created. If you go to my Instagram handle, you would see a whole lot of images I've created. Of course, this is just the process. This is an illustration of lupus, which I've created also, which is also one of the symptoms also. I'm just going to share some final illustrations also. Just some seconds, please. All right, so. Okay, I don't know if you can see on screen, right?
Yes, we can see it.
All right, so this is for hydrogenated suppurativa, which was created on a Hispanic patient. Because for me, when I talk about representation, it's not just about Black people, but it's for the other ethnic group that is not white. So I created these for one of the projects I'm working on. And also this is a pelvic anatomy, which I created also. For monkeypox also, which is a recent disease that is ongoing right now. So I created this for a measure of advocacy. And this is also for, I created this breast cancer illustration. And for me, this is an artwork that I love so much, because it particularly tells a lot of messages. It's as much as a medical illustration, it's also a message also. And this is one of the artworks I've created about mastectomy, that a mother can still undergo mastectomy and still breastfeed based on the advice of the physician and on the best time to start breastfeeding. So this is still proper labeling of the illustration that I've created. because I understand that recently most images are not actually that shows the female genitalia are actually not common on Black people, and people shy away from showing images like these. And for me, if you look close to detail, you notice the stretch marks that are in these illustrations, and that is to say that that everybody is meant to be represented. So for me, details like these are important in illustrations, and that's why I portrayed them in my artworks. So these are also illustrations I've created also. Yeah, so this is just one of many that I've created, and there's still more on my Instagram handles and my social media handles. So thank you.
And we have a couple more questions. We'll start with raised hands first, and then I think there's one or two in the chat that I'll read out afterwards.
Wonderful. I just wanted to start by saying thank you for being here. Thank you for sharing with us, especially with the story that you told in the beginning about the pulmonary embolism patient. Like, that was really sobering, especially as like a Black clinician. I'm like so invested in how do we care better for Black patients. And you talked about engagement in clinical trials. So I was kind of curious about what your thoughts are on steps to bridge the gap for Black patients participating in things like that, and also building the confidence in our community to encourage self-advocacy during like moments that you're in the healthcare setting.
Sorry, can you repeat your question again? I actually lost you at some point.
Yeah, so just how do we encourage, like, first of all, more Black people to participate in clinical trials? And second of all, how do we encourage self-advocacy when we find ourselves in things like, hospital settings or clinics and things like that?
Yes, so thank you for that. So I think that so because of the issue of Black people having the understanding that they are not valued and respected, and that's the reason why most Black people do not engage in clinical trials. So it is important to take a step. I mean, I would say it's actually a progressive step, I would say. So if we're looking towards including Black people in clinical trials, it's important to also make them understand that they are valued and respected. And that simply starts with how well they are represented. Because the Black people understand that that being Black has a factor to how well they receive healthcare. And because of the understanding, they do not see it important to engage in clinical trials that do not represent them, that do not have that is not directional to them actually. So for example, if there are a couple of pharmaceutical companies who are creating moisturizers or lotions that could be used for sunburns, most times these lotions are being created for white skin, and Black people are having the understanding that typically there's an assumption that if I'm Black, right, I do not usually have skin ulcer or skin burn. Because of that understanding, right, they did not see it important to engage in clinical trials that could be important to them. So I think the idea is that we ought to educate them that if they are involved in these, right, it has a good approach in improving their own healthcare outcome. If they are involved in, because I think in as much as we advocate that the healthcare outcome of the Black community should improve, I strongly believe that the Black also have a role in playing in also improving their healthcare outcome. And that's also having seen the importance, seeing the need to be involved in clinical trials like this, because that's where we can say that this particular, like for example, the pulse oximeter, for example, that if Black people are involved in clinical trials like that, we can say that this is definitely going to work on the Black patient and going to have accurate detection, and of course would improve the healthcare outcome for a Black patient. So I think if we educate them that is their role, that is the effort they have to put also in seeing how we can also improve healthcare outcome for them. So I think they would see a need to be involved in it. And for patients or for the underserved communities who find themselves in the hospital setting, I think it's important to know that first of all, the worth and value and respect that from you as a person, right? How well do you see yourself? How well do you have that value for yourself? and then we can say that we can have contributions to make to our physician. I know it is difficult most times because the physicians, of course, feel that they have their opinions are the best, of course, and most times they do not listen to the minority group or to other ethnic group. So I think that we ought to see how we can contribute our personal opinion, which of course is difficult, and hopefully that the physician listens, which is a difficult task to do. And with this, I strongly believe that we can see how we can be involved in this. And of course, we have to personally talk about our personal experiences, which of course I've earlier highlighted, because when we talk about personal experiences, people are now aware that issues like this exist. And of course, they have approaches in tackling factors or tackling issues like how like lack of representation or like healthcare inequity towards the underserved community. So for me, I think that's for me, that's the perspective. That's what I think could be done about that. Thank you.
Thank you so much for your answer.
Thank you.
Okay, I think the next ones are a couple of quick questions. So the first one is, what are you thinking your next creation will be?
Well, that's actually very tricky, but it's good. So for me, actually, my next creation, I'm actually working a lot of projects right now. And the artworks are focused on skin condition. I'm working on the skin condition series. And because I want to see how to populate illustrations on skin condition. So for now, I do not particularly know the exact illustration I'm going to create, but I know it's focused on dermatology because that is the project I'm working on right now. But I don't exactly know the particular skin condition that I'm going to be creating soon. But I'm working on a couple of projects. Like before the call right now, I was doing an illustration of cataract, which is for a project I'm working on with a client. So that's for a client, but my personal project is focused on skin conditions. Yeah.
Thank you. And you may have answered this already, but someone has asked what software you use.
Okay, yeah. So I actually use Photoshop for illustrations, and I use a tablet right now for my illustrations. So I use, before now I was using Adobe Illustrator, but which is actually inefficient. So I'm actually using Adobe Photoshop for my illustrations. And most times, if I'm actually traveling or I'm actually on the go and I want to illustrate, I use Procreate on my iPad to create illustrations. So those two softwares are what I use.
Wonderful. That's everything I have in the chat. Does anyone else on the call have any questions at this time? Okay, I'm not seeing anything. So thank you, everyone. Thank you, Chidiebere, for being here. This has been a wonderful session. And I've heard from many people who couldn't be here for the early morning that they will tune into the recording later. So I will send out information about that after it's been edited and it's up on our site. But thank you, everyone, so much for your time. And we look forward to seeing you at our next OBLIQUITY session, which is happening on October 26th.